When Mr. Wilson sat down, there was no mistaking what the focus would be. His nose carried the telltale signs of blackheads and whiteheads that had built up over time. The practitioner's opening words, half teasing and half clinical, framed the moment perfectly. This nose was due for a serious squeeze. From the bridge down to the tip, the pores seemed filled and congested, a small map of the skin's struggle to keep up with oil production and exposure. Even the creases around his nostrils showed evidence of stubborn blockages, the kind that resist daily washing and demand a careful, skilled hand. The session began with patience, easing into the task by gently teasing out the first few plugs. It wasn't about rushing or forcing, but about coaxing the skin to release what it had been holding onto. Each extraction brought a mix of sensations: the faint sting of pressure, the awkward pull of resistance, and then the sudden release as the pore gave way. Relief came not just in the clearing itself, but in knowing that each step was progress toward a cleaner, healthier surface. For Mr. Wilson, this wasn't a routine he was used to. It was his first facial, and the unfamiliar process could have easily felt overwhelming. But the practitioner's calm tone and steady encouragement turned it into something manageable, even empowering. Being called a trooper wasn't just flattery, it was a reminder that enduring a little discomfort could lead to visible change. The first squeezes set the tone for the entire session, laying the foundation for what would follow. They showed that transformation doesn't happen all at once, but pore by pore, moment by moment. What began as a nose dotted with stubborn spots was already starting to look different, and though the journey was far from finished, the early progress carried its own sense of reward. In that chair, under the careful hands of someone who balanced expertise with reassurance, Mr. Wilson's experience became more than just a clinical procedure. It was the beginning of a process that blended patience, humor, and skill. The first squeeze in a story his skin had been waiting to tell. The real work began once the first few blackheads were out of the way, and it quickly became clear that patience would be just as important as pressure. The practitioner's steady hands moved methodically across Mr. Wilson's nose, searching out the deeper clogs that had been building for weeks, maybe even months. Some came free with ease, slipping out with a gentle press, leaving the skin instantly lighter. Others dug in their heels, resisting with stubborn persistence and requiring repeated, careful squeezes. These were the ones that tested not only the practitioner's skill, but also Mr. Wilson's tolerance for discomfort. Balancing technique with compassion, the practitioner made sure not to push too hard or too fast. A pause here, a softer touch there. These small adjustments spoke volumes about the art of extraction. It wasn't just about clearing pores, it was about guiding the patient through a process that could easily have been overwhelming if handled without care. Between the presses and wipes, the dialogue kept flowing. A playful comment about Mr. Wilson's nose being famous lightened the mood. Observations about his so-called fans watching his progress added humor to an otherwise clinical setting. These moments of levity created breathing room, giving him a chance to relax and even laugh while enduring the awkward pressure on such a sensitive area of his face. Each successful extraction brought its own sense of satisfaction. The practitioner acknowledged the victories, no matter how small, while keeping the overall goal in mind: a clearer, healthier looking nose. Every pore that released its contents became part of the bigger picture, the transformation slowly unfolding in front of both patient and practitioner. Progress wasn't measured in dramatic changes, but in steady, consistent wins. Bit by bit, the congestion loosened its grip, and what once looked like a battlefield of clogged pores began to smooth out into something fresh. In that careful rhythm of pressure and patience, trust grew. Mr. Wilson learned that discomfort had a purpose, and that persistence would lead to visible improvement. What might have been a stressful experience became an unexpectedly reassuring one, thanks to the balance of humor, empathy, and skilled technique guiding every step of the way. Some extractions carried a rhythm, almost predictable in their release, but every so often there came one that refused to cooperate. Mr. Wilson's nose had plenty of these reluctant blemishes, but one in particular caught the practitioner's eye. It was darker than the rest, a pore so deeply oxidized that it almost looked like a tiny speck of coal pressed into the skin. Unlike its smaller neighbors, which surrendered quickly under light pressure, this one sat anchored as if determined to stay put no matter how many attempts were made to dislodge it. and the practitioner adjusted technique, applying just enough pressure without crossing into harm. A little rocking motion, a shift in angle, a pause to allow the skin to respond. The process was meticulous. Mr. Wilson winced at times, the sensation sharper than with the easier extractions, but he stayed steady under the guidance and reassurance being offered. Patience paid off. After several attempts, the pore finally released, giving way with the kind of visible result that left both patient and practitioner feeling a shared sense of triumph. That stubborn blemish, once an immovable mark on the nose, was now cleared, leaving behind only the promise of smoother skin. It wasn't a solo effort either. Jackie, the esthetician, played an important supporting role, stepping in to tackle some of the tougher areas that demanded extra precision. Her success in freeing another resistant clog earned recognition and showed how dermatological care often relies on teamwork. It isn't just one pair of hands, but the collaboration of skilled professionals working together to bring about the best outcome for the patient. These darker, more stubborn blackheads became symbolic of the process itself. They reminded Mr. Wilson that transformation doesn't always come easy. Some blockages take more time, more patience, and more persistence before they give way. Yet, when they finally do, the relief is greater, the progress more noticeable, and the trust between practitioner and patient even stronger. What might have been just another pore became a small but powerful victory in the larger journey toward clearer skin. Each dark spot that yielded under pressure was proof that even the most resistant problems could be resolved with care, skill, and determination. Between the steady rhythm of squeezes and wipes, there was another rhythm at play. The easy flow of conversation. Mr. Wilson, new to the world of facials, found himself at the center of an experience that was as much about connection as it was about extractions. The practitioner, knowing that first timers can tense up under the awkwardness of pressure and pinching, sprinkled humor throughout the session. A light-hearted jab about Mr. Wilson's nose being famous, or followed by fans, turned a clinical procedure into a shared moment of amusement. What stood out most was the playful mention of his wife, who was described as being just a little jealous of the star treatment he was receiving. The practitioner teased about how she often asked if she could get her own blackhead pops, a comment that drew laughter and softened the entire mood of the room. This banter wasn't idle chatter. It was intentional. It reframed what could have been a cold, clinical process into something warm, relatable, and even entertaining. Mr. Wilson wasn't just a patient lying under the glare of a magnifying light. He was part of a conversation, a relationship built in real time through humor and reassurance. Every chuckle became a counterbalance to the discomfort of the extractions. Humor dulled the sting of pressure, making the procedure more bearable. More than that, it gave Mr. Wilson permission to relax, to engage, and to see the session as something beyond a medical necessity. It highlighted the often overlooked truth that skincare is not only technical, it's personal. Trust builds in these small, human exchanges, and that trust allows the practitioner to do the more difficult, sometimes painful work with greater ease. In the end, it wasn't only about the pores being cleared, but also about the atmosphere being created. Humor and human touch transformed the session from a purely physical treatment into a shared experience. For Mr. Wilson, the laughter and lighthearted remarks became as memorable as the progress on his skin. For those watching, it was a reminder that healing often comes hand in hand with kindness, reassurance, and the ability to make someone smile in the midst of discomfort.